Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Chandler, Arizona. For now, we are moving. I will let you know when. I have a lot to talk about today. This is an episode that I've been thinking a lot about for years, actually. This is a topic that has been with me for years. So before I get into it and share with you what this is, please tag in here and like, share, and subscribe, and then we'll get going. I want to talk about, so this is a part of my series on trauma and how trauma affects us and how trauma affects the endocrine system. And this is going to seem like a weird subject to bring up in light of that, but it is linked. And it's going to talk about the immune system. I have people who've reached out to me online, a lot of times in the comments section, and then also subscribers will send me a message regarding this. And a lot of times you'll hear people coming back with, I have chronic Lyme disease. What do? I have a chronic fungal infection. I have fibromyalgia. The thing you'd say or think is like, why would someone reach out to this podcast or to me and ask me about Lyme disease? Or ask me about fibromyalgia, or ask me about a fungal infection that won't go away. Why? It's not something you would hear on many of my episodes. My episodes are geared primarily towards the endocrine system, towards hormones, specifically estrogen, progesterone, testosterone. I do talk about insulin with weight. We talk a little bit about diet. We talk about inflammation. But a lot of these things are stuck within the endocrine sphere. Why would these people ask me questions about chronic infections that won't go away? What's important to understand is there's a few reasons. One is that population not very well cared for. They fall through the cracks. They're not well helped. They go to their doctor's office and they don't really receive care anymore because they didn't get cured by the normal protocol that works. And so they start looking, and they look for a friendly face in the crowd. They look for someone who cares. They look for someone who they think wants to be helpful. So that's one reason. But another one is the fact that your endocrine system and your immune system are intimately related. And then you say, well, that's a good subject, Brendan, so then why are you bringing it to trauma? Your endocrine system and your immune system and your neurobiology are all really linked. It's hard to discuss this because we know they are linked. We all know this, by the way. You know that your emotional state will affect your immune system. And you know your hormones affect your emotional state. And you know this could be this whole big circle with it, right? But when you go to the doctor with, an infection, you don't think, let's talk about trauma in my life, And when you go to your doctor with your hormones out of balance, you don't think, let's talk about this infection I have. You don't really think about these links, and there's other reasons too, but these things you don't normally put together when you're going to be clinical. But if you think about it philosophically, they're all linked. So what I want to do is I want to discuss how there's a link between chronic viral, chronic bacterial, chronic fungal infections, and how that link goes to your endocrine system with your adrenals and your reproductive hormones. And then I'm going to talk about how that's linked to trauma. I'm going to talk about how I treat these people. This is going to be a 2-part episode. This may come across as one of the more bumpy episodes I've done. The reason why is that originally this presentation that I'm doing today, this episode, was made as a presentation I did as a lecture before physicians. And, it was a really technical piece that I wrote. And a lot of citations, and it's very technical because, you need to prove your point with this group, and it has to be very bulleted, very strong. And I wanted to bring that science to this episode. Why this is bumpy is because I'm not talking to doctors. I'm talking to you. And a part of this is me wanting to comfort you and to assure you and to communicate this in a way that's helpful. Because I've been practicing 20 years. And in all those years of practice, I can say that your population is the one that has been the hardest to treat because it's not been treated well. And it is a hard one to treat. And it calls out of me when you see people in distress and you're a care provider, if this is your calling, it calls out the best in you. I try to really focus on being the best person I can be in moments like this with cases like yours. So right now I'm combining a very technical piece of material with a very emotionally present person. And I want to present it at a level that's understandable to you as a patient. So if it's bumpy, forgive me. All right. Then another thing, remember, your comments mean everything to Justin and I. We read them. We were just talking about it. We just set up. We spent probably about a half an hour to an hour talking about comments that we've seen in the reels and in our YouTube. These things matter to us. So if you get this episode and you think this is helpful, but man, I need a little more of this, a little less of that, let us know. Please send us comments. So into the material. I want to talk about just a basic approach that we have with a patient who presents to clinic. You know, I'll have a person recently, I had a patient present to clinic with a case of Lyme disease. Now, Lyme is common, becoming more common because it's becoming warmer around the world. And anyone can say what they want about that, but it is warmer. So we are seeing more cases of Lyme. And so when a patient presents with this infection, you know, my common protocol, of course, run labs, and I find that this is positive for them. I'll prescribe them doxycycline, which is an antibiotic, and that's generally more than enough. And I'll do that for a prescribed period of time. At the end of that, I'll go along and give them probiotics to make sure that their immune system is being better modulated through their intestinal tract, because that's a part of what probiotics do. I'm also replenishing the lost probiotics that were in their body that I had killed off by using doxycycline. And then that patient goes on their way, and we're good. And I don't see him again for this. I'll see him for something else, but I probably will never see him again for Lyme. That's normal. What happens when I see that a person and maybe it doesn't work that way? Think about this. Most bacterial, viral, or fungal infections in a clinic are treated with immune-based therapies. Just that's what we do. And that generally is what works. What makes it maybe a little fancier is like when I did that antibiotic, doxycycline, give them a probiotic. That's fancy. Or being fancy is the kind of doctor I am. Why is your immune system low? What's the issue with your immune system? Maybe I'll give you some things that'll bolster up your immune system. That's still immune-based therapy, and it's your basic medicine for bacterial, viral, or fungal infections. What happens, though, when it doesn't work well? What happens? What's the next thing we do? The next thing that happens when you have a case and you have someone who's sick and you give them your antimicrobial, antiviral, antifungal, or antibiotic and say it's not working well, what are we doing next? We're always going to step into the area and we're going to think about their adrenals. We're going to think about cortisol. Cortisol is an important part of the immune response, and cortisol is the endocrine system. And the cortisol will get involved in immune response every single time. First you have an infection, your immune system goes after the infection. Part of that response to the immune infection response is you're going to release cytokines. These are little chemicals that go into circulation that help your body fight that infection. Problem with cytokines is if they get to be too much, it creates too much inflammation throughout your body, you really don't feel well. When your brain perceives that cytokine elevation from an infection, it sends a message to the adrenal gland and says, hey, we need cortisol. Cortisol now comes throughout your body and it modulates your immune system. So a normal person, a healthy person presenting to clinic with a bacterial infection that needs an antibiotic because their immune system can't overcome it itself, I generally just need to give an antimicrobial. And we could do a natural antibiotic, something that's plant-based, or we can use an antibiotic if we need one. If it's going to be resistant to one or the other, we find out and we treat with what works. Okay? I always do what works first. If their body is responding well and their adrenals are healthy, it's a limited problem, they're good. If their adrenals are not healthy, then the immune system can become overrun and the body can start to have too much inflammation throughout it, to having too strong of a reaction because you don't have healthy immune modulation from your adrenal gland. Why would that happen? It's common for people to have a lot of stress. It's common for people to not get enough sleep. It's common for people to work too many hours in a day. There's a lot of things that cause stress. That type of adrenal insufficiency, secondary to chronic stress, that will reduce your natural cortisol. and let this infection now become a little bit more robust than it should have been. That's when you see someone that gets more sick than their coworker. You know, they got the same infection, but this person's way worse off. A lot of times that's because their immune system, it's not being modulated by cortisol. And that has to do with often chronic stress. So in those cases, your general practitioners, if they're seeing you have a bad response, maybe your cytokines are getting too high, there's too much inflammation, they do prescribe you a synthetic corticosteroid, which is an analog of cortisol. They're going to give you prednisone, okay? And what prednisone is going to do is going to suppress that immune response and calm it down. When your body does it with cortisol, it's elegant because your cortisol you make lasts 2 hours in circulation. And your body releases just enough to balance out your cytokines, to balance out your own inflammation. When we give you prednisone, we're going to suppress everything. And that suppression, sometimes you need to do it. And I'm not afraid to prescribe that. And I have prescribed prednisone. This is important to know. It's not that it's a bad thing. It's a part of treatment. But there are consequences to every therapy we do. And as a physician, we need to always think about what those consequences are and what else is happening at play. So when someone has that irregularity and their cortisol is not really responding well, and their inflammatory markers, cytokines, get too high, and we give them prednisone, it will calm everything down right away. Where the catch is that by that calming it down, with prednisone or very strong corticosteroids, it'll suppress it so far down that your innate immune system becomes weak. If you use a suppressive dose of prednisone, your immune system now goes to sleep. And it's easy to get sick with something else. If you suppress someone's immune system with corticosteroids, you also have that risk of dormant viral infections coming back to wake up. The human herpes virus comes back. So corticosteroids, while useful in a clinic, you have to be cautious on how you use them. So far, I want to sum things up a little bit and then keep moving forward. So far, I've talked about your immune system and how your immune system will react to a viral, bacterial, fungal infection. And if your immune system can handle it, we use an antimicrobial that's specific to an antifungal, antibacterial, antiviral, if necessary. If we're going to be fancy, we're going to promote the immune system best we can, use natural versions as much as possible, and replenish what we broke down. That's not, it shouldn't be called fancy. That's real medicine, by the way. That's how it's supposed to be done. But that's considered nowadays to be fancy. Whatever. There's that. We will sometimes need to step in and start using the endocrine system, specifically cortisol analogs like prednisone. If the immune system goes too strong of a reaction, what would cause that hyper response in the immune system? Often, it's going to be chronic stress, reducing your natural production of cortisol. Okay? So this is that face that we're looking at so far. And we know that if I use too much prednisone, that's going to suppress your natural immune system and allow other chronic viral infections to take root, or you to, if you have a dormant viral infection like human herpes virus, it'll allow that to come forward. Okay? This is real complex stuff. And it's so important I get this part right to explain it to you. So I'm trying to make sure I repeat myself a few times and reiterate myself and circle back a few times. Because, again, my goal, more than anything, I don't want to sound smart. I don't want to come across any other way other than very clear. Because this material is for you, not me, not anyone else. This is for me trying to explain this to you so it takes root in your mind and you can start to learn from this. And hopefully this will help you develop a better understanding of what's happening in your own health so that you can take command of this a little bit more and start taking a little bit more leadership and direction in what's going on with you. So what other parts of the endocrine system get involved now? After we've talked about the immune system to the beginning of the endocrine system with cortisol, what other hormones are at play? I'm glad you asked. The other one we would want to be considering is your reproductive hormones, believe it or not. And this is where people get frustrated because they're like, Brendan, you're taking too far of a leap. I'm not. I want you to know, I know this for a fact. This right here is not a big leap. Bear with me. When that person presents to clinic with chronic stress-induced low levels of cortisol, And they are more prone to chronic viral infections or chronic fungal or chronic bacterial. We always want to fortify and replenish and to protect the hypothalamic pituitary adrenal axis. And that's that stress response axis in the body, right? We want to get their cortisol levels naturally to be back up, promoting sleep, promoting self-care, healthy diet, emotional balance. What causes the hypothalamic pituitary adrenal axis to get crazy, too much? What is that? That chronic stress. How can I help them with that? Well, let's first step back and understand what causes us to perceive stress around us. It's the perception of stress that the amygdala, right, in the deeper part of the brain, that causes us to have these strong responses. When you see something scary, you look at it, you see it, your brain interprets it, this is scary. The amygdala, something's bad here. Fight or flight index. We got to either fight it or we got to run away. So that's the first initial response, and that's what causes that cortisol. What if your amygdala is dysregulated? What if you have a deficiency of, say, testosterone? Let's use that one first, okay? I don't talk enough about testosterone in this podcast, so let's do that today. Testosterone. If you have a deficiency of testosterone and you're a woman and you're supposed to have testosterone, anyone who says you're not supposed to have testosterone as a woman really is not medically educated. This is the truth. You are meant to have that, just like I'm meant to have estrogen. We all have these hormones. It has to do with the ratio and how it's present in your body. So you make it. Testosterone in your brain shows up, androstenedione is the name of it. And that helps modulate the way you perceive fear and stress. Studies show that women who have low testosterone perceive angry faces as being more scary. Women who have low levels of testosterone are not as inclined to explore anxiogenic parts of the environment. That's a technical term, but there's great studies explaining how when your androgen levels are low in the brain, you tend to kind of avoid things that would make you nervous. So when you have low levels of androgens and you perceive stress in front of you, you feel like you crumple more quickly. You stress more quickly. You have a higher response. What's a common cause of low testosterone in women? Oral contraceptives. The research is very clear. It's very clear. And it's known in science for a long time. I've written numerous episodes on this and presented them. This is not something that can be argued any longer. Oral contraceptives do cause a low level of free testosterone in women, and that will contribute to your perception of stress. So that's the first thing to think about is testosterone. What other hormones are at play? Progesterone, my favorite. I wrote a book about progesterone, and I never plug myself, so I'm not really plugging the book. I'm not telling you to buy it. But I want to say I took the time in my life to write a book as a love letter to progesterone and what it does. It's mostly a love letter to progesterone, but partly it's also a love letter to my patients about thank you for them trusting me all these years and what I've learned and how I've grown through it. But progesterone is the shock absorber of life in your brain. Progesterone, when it crosses the blood-brain barrier, turns into allopregnanolone. And allopregnanolone is something called a GABA agonist. What that does is like when you're driving down a bumpy road and you have good shock absorbers, you don't really feel the bumps. You're making it through. You know it's a bumpy road. Sorry, you know it, but it's not throwing you all around. Progesterone, if you don't have progesterone, there's no shock absorbers. You feel every bump in the road. When a woman has low progesterone and going through her cycle, PMS, PMDD, all of it is due to low progesterone. And that low progesterone means low allopregnanolone. So when a woman perceives stress and she has low progesterone, whether she wants to or not, she experiences anxiety. That anxiety state also further triggers that cortisol response. So this is, again, your immune system should do its job. It's helped by cortisol. If cortisol is broken, it tends to be due to our perception of stress or how we experience stress in our lives. It could be due to low testosterone, low progesterone. There's more. But I want to make sure you understand there is a reproductive component of this. And it's such an important part to discuss. Because when a person presents to clinic and they have a chronic viral infection, or in the case of the patient who asked me to write this, or the person online who asked me to write this episode, it could be due to Lyme disease. And so she has this Lyme disease, and doxycycline and fancy medicine, which is, probiotics and immune support things in there, didn't work. What's going on with her cortisol levels? What if she's having a hyper response? I have to use prednisone. Why? What's going on with this person? I want to look at the adrenal axis. If the adrenal axis shows me cortisol suppression, deficient cortisol, that would have come from years of high stress. That could be due to, commonly in women, low testosterone, low progesterone. So you see how I'm weaving together this woman in front of me. I'm thinking about my fancy protocol with my antimicrobials. I'm thinking about how I'm going to fortify her adrenal axis. Sometimes I'll have to prescribe her hydrocortisone. Sometimes, if necessary, of course, as I mentioned, I will use prednisone because I am a doctor and your life is sacred. And my ego is nothing on the table here. And I hate when doctors are like, oh, I'll use this because this is the only way it works. No, you do what works for the person in front of you. You never do what you believe should work best. There's an ego thing about doctors who believe that their therapies, the way they are perfect, and they never are present for the person in front of them. It's weird. It drives me crazy. But this woman in front of me now, if I need to use prednisone, I will. And I will do it well. Because I will watch for after prednisone, she'll have adrenal suppression even worse. So I'm going to bolster that up the best that I can. So I'm always thinking about this hypothalamic pituitary adrenal axis, and I'll use what therapy works in that moment for her. That's not enough. Because the woman out there who's listening to you right now said, but Brendan, I'm still have this infection. Why didn't this kill it? Why didn't this fix it? We look again, where is your progesterone? Where's your testosterone? Those are two big key parts of this. How are you perceiving stress around you? If you're under chronic stress in the world around you, your immune system will be dysregulated. It'll be difficult for us to clear a viral infection, a chronic viral infection, a chronic bacterial infection. If you have persistent stress in your life around you, more than just what the virus is giving you, and your perception of stress is so far off, if it's due to progesterone and testosterone, we need to fix that. So the next part is the big leap I'm going to take into trauma. And I'm going to do that the next episode. But before I do cliffhanger on you, I want to say that trauma is the linking component here in chronic viral infections. I have long-lasting infections, not chronic, but difficult to treat, but still responsive, when I have to go all the way to their hormones for their progesterone and their testosterone. They're still treatable. That's not the chronic, okay? That's still treatable. That's in this area. Not once in my life have I seen a chronic viral infection, chronic bacterial infection, or chronic fungal infection where there wasn't a trauma associated with it. Now, I am open to being wrong, and I'm only been practicing 20 years. I got 20 more ahead of me. So I may find that happens, and that's there. And there's a chance that, COVID, long COVID, that chronic infection may be more associated with other things other than trauma. But I think it's time we give trauma its fair shake in this subject. It's time to talk about it in terms of this, because it isn't clinically. It's years of my life. I've sat in the room and I've heard you, and I know how you feel. So, next episode, 7 days out, we'll get back to the subject. Thank you for joining me today. It means everything that you do. This podcast is a labor of love that Justin and I do. It's something that we feel very strongly about. The message means so much. And if you look at the comments in some of our reels or on YouTube, and I know we're getting more and more traction on podcasts out there nowadays, but if you were to look at these comments that people write, you'll see why. There's such a need for this community. And I love watching women interact with one another, support one another, and care for one another in the comment section. That is such an important part of this to me. And so please, not just like, share, and subscribe, but please comment when something grabs you. And if you've experienced something and you see someone struggling with it in the comment section, it's not enough for just me to say something. It really isn't. I know this. It's important to have a community of people supporting you. It's never good for just one person. So I just welcome your contributions. I welcome your presence. So thank you so much for tuning in. I will see you at the next episode.